Hi, my name's Michael Albisser, and I'm a research professor of medicine. I spent 40 years of my life trying to understand why people with diabetes develop severe problems like eye disease, like neuropathy, why disease leads to amputations, to kidney failure. I had a dad who died from diabetes because they couldn't control his blood glucose. How many of you have friends or relatives or loved ones who are suffering from the complications of diabetes? Well, over these years, I had the good fortune working in an academic environment to develop brand new technology that can prevent those problems. If you know somebody who has eye problems, then there is a new technology out there for you to tap into. It is called interactive diabetes control, and it will work with you and your healthcare providers and your families in a way that was never perceived of before, that can help you prevent those problems, and in many cases, if they're early, it will help you reverse them. If you're interested in accomplishing these results and in participating in a brand new movement that is called interactive diabetes control, then call the number that you see on the screen. We will work with you to make the biggest difference that there has ever been for you. Let me tell you of an example. One person who was on an insulin pump who had diabetes for 30 years. And in those 30 years, his blood glucose wasn't particularly well controlled. In fact, it was all over the map. And he resorted to an insulin pump after he had a stroke that was due to poor diabetes control. The pump was supposed to prevent further progression of any complications. He worked with 2 endocrinologists, and the control after 1 year got worse. He came to our group, to our support group, and said, "My eye doctor has said that if I can't get my glucoses under control, stat, now, I'm going to have eye treatments, probably laser treatments, in order to slow it down." To slow what? The progression of damage to his eyes. He joined the support group. His doctor got involved and said, "Go ahead and do anything you can to get his glucoses under control." Interactive diabetes control asked him to collect 14 blood glucose readings a week, enter them into the cloud, into the software that supports this interactive diabetes control. That software is called Humalink. And within 8 weeks, actually 9 weeks, his glucose control was model. It was the best that anybody could achieve because of his efforts and the support of the interactive diabetes control community, support group, and software. After 9 weeks, he went back to the doctor, the eye doctor, and said, "I'm back. How are the eyes?" The doctor examined the eyes, and he went, "Oh, what's happened to your eyes?" The poor man almost died on the spot. He said, "What are you concerned about?" The doctor said, "Well, your eyes are normal. I don't have to do any treatment." Well, that was the biggest surprise that all of us, none of us expected this to happen. Why? Interactive diabetes control that gets the individual into the target ranges can actually reverse eye disease. Wow. We had a person who went into the hospital, and his feet, one of his feet got burnt in a sauna, very badly burnt. And in the hospital, they did surgery, they tried to control his diabetes, and they failed. He came back to our group, and we said, "Well, we will work with him. He's one of our people, and we'll do the best that we can." And within a week of working with interactive diabetes control and following the steps that are necessary to do this, his blood glucose came under control. The problems that he had in the hospital environment that included a seizure, actually 2 seizures, that were due to unregulatable blood glucose, these were reversed. We have another person who, on an insulin pump, was so poorly controlled that she couldn't leave the house. She certainly didn't want to travel to see her family. The pump is supposed to give perfect control. That's what they say. Very difficult diabetes. Use a pump. Well, most often it doesn't do that. This woman, again, worked with us in a period of 8 weeks, got her diabetes under the control that she now doesn't suffer hypoglycemia anymore and has no trouble going to an airport, to an airplane and sitting on the airplane flying to her family. That was denied to her because of poor diabetes control. By the way, poor diabetes control and standard diabetes control, standard diabetes care, sort of go hand in hand. And today, we can make standard care different through the use of integrated diabetes control. The procedure is simple. All you have to do is appear, volunteer, come to our support groups, and learn. If you're a candidate, if you're concerned about your eyes, your kidneys, you're having tingling in your fingers or your feet, this is the time to start paying attention to your diabetes and to say, it's time for me to have not only standard diabetes care, but to have standard diabetes care that is enhanced with interactive diabetes control, and the software that we have will be accessible to you on the cloud. So think about your status, think about that of your relatives, think about that of your friends, think about of the people who are dear to you. If they are having problems with their diabetes, now is the time to step in, see if it can be stopped, see if it can be reversed. Call the number on the screen and come and meet with us at our support groups. Thank you.
You have a passion to help the world. You have a passion to provide medical equipment that helps change people's lives, but you also have a personal passion for the diabetes. Tell us what really drove you to the passion and what brought you to where you are now.
Well, Terry, my family has had very severe diabetes from type 1 to type 2 for as long as I can remember. I've about 40, 50 years I've dealt with it with my family. I've lost 5 members. Each of them lost eyesight, lost legs, even fingers. They had problems with kidneys and all kinds of other major issues. All the things that Michael talks about that can be avoided with his program. And there's nothing we could do, not a thing. Because no one could help them control those sugar levels to the level that they needed to have them. That blood glucose was just deadly. So throughout my entire career in this industry, I've been using the electromuscular stimulator to try to make up for that, to try to change as much as I could people's lives. I've never been able to help them with retinopathy, of course, or with kidney and liver issues and the such, or even with nervous problems or nerve issues. But in the neuropathy world, we did. Now, all of a sudden, coming together with Michael and using this fabulous software that allows us to literally go worldwide, not just here in the United States, where there's about 18 million people that have diabetes. The world has mammoth numbers beyond that. There are countries out there with 35, 40, even higher percentages of diabetes, and you can't reach them with the normal technology that's out there. This software literally goes worldwide, and it goes that way immediately. And amazingly enough, we've already got the massive connections available to do that with.
So your dream was inspired by loss of family.
Absolutely.